Good morning. I'm going to do an incentive spirometry. So the first thing I'm going to do is always check the patient's charts to see what the doctor has ordered and to see when their pain medications are at, if they had an operative, something done with their anything like lung, stomach, anything that may have done operated on them. So then when I am ready, I'll get my machine ready and I'm going to use a volumetric exercisers. So this is just going to help them increase their inspired volume. That way it gets their lungs open, helps them breathe better, gets any secretions, anything out. And if they had surgery or anything, this can help prevent any atelectasis that they may get from being bedridden or anything like that. So I'm going to get this ready here in just a minute. I'm going to wash my hands, dry my hands, and as always, I always want to make sure I have the correct patient, check their ID band, then I'll obtain the vital signs and auscultate the lungs to listen to see what they sound like before the treatment. So here we have the volumetric exerciser. So this here, it always comes with a chart. So you can always chart, there's a chart for a female and there's a chart for a male, and you'll go based off the age and their height. So like I'm gonna use me as the demonstration to how to perform this machine. So I'm in between 20 and 25, and then I would do 1900, 1850, around there. So I'm just gonna set it around there. Now if they are post-operative and they just got out of surgery, you can start at the lowest thing. Just that way it doesn't cause any pain for them when they're breathing. It just helps get them exercising their lungs and getting them opened up after surgery. So I'm gonna hook this up to here. And there can be a machine too that you can hook up to measure the tidal, like you can measure the tidal volume, the vital capacity of the patient's lungs, to chart in the patient's to see where they are at. So as always, you'll have it laying flat and you would position the patient upright to where they can be able to get the good lung capacity that they need to perform this. And if they can't get up on their own, then I'd raise the bed just to help them get them up. And then I can also give them something to hold if they're from surgery, that way it doesn't hurt them or cause any more pain than they're in. So what you do is you take a deep breath in first and exhale. So I deep and exhale. And then when I breathe in, I will hold it. And then I have to wait till this falls down, the piston falls down. All right, so I'm going to take the deep breath in and exhale and then breathe in. And then I would chart to see where they are at. So I didn't get quite to where I needed to be. And then I chart, see if how good my volume was, if it was best, better, if it's good. All right. So when you are done, you can remove this and set this in a safety place. Cover up the mouthpiece, and when they're completely done, you can also wash it in warm soapy water just to get it clean, especially if they're going to take it home with them. And you can put this in an appropriate place, but if they still have to do some more treatments, you can set it alongside their bedside here. That way they can do it. They need to do it at least 6 to 10 times per hour, just depending on where they're at. If they can't quite get that many, that's fine. We'll just work them up to where they need to be when they are done. So then I would wash my hands, remove any gloving that I have on, wash my hands, dry them, and then I would reassess the patient. I would get their vital signs, listen to their lungs to see if it's helping expand their lungs, clear out their lungs better. And then I would chart on the patient's charts and let the doctor know where they are at and if they need see if they need anything else to them.